Okay, first laugh, because that keeps our cancers away. Everybody? Next, stand up really quickly. Really quick, come on, you've been sitting a long time. Do just a little hop. Now sit down and grab your knee. Sit down, grab your knee. Okay, so this morning, when you were doing your Frisbee yoga, you twisted your knee, you heard a pop, your knee swelled. You went over to the local orthopedic surgeon. He said the data is that you have a 90% chance with that history of having torn your ACL or your meniscus or your articular cartilage and having a surgical knee. Don't worry, he'll go in, he'll take out that torn tissue, shave down that damaged cartilage, take out the front of your knee, your patellar tendon or your hamstring, and rebuild your ACL. You're going to be just great. You thought about that for a little bit, and you thought, you know, taking away all my tissues in the 21st century doesn't sound very good. So you came over to my office and you said, hey, doc, what should I do? And so this next talk is about me talking to you and what you should do, okay? All right.
We're all aware of the risk of cancer, but there's another disease that's destined to affect even more of us, arthritis.
Louder?
Cancer may kill you, but when you look at the numbers, arthritis ruins more lives. Assuming you live a long life, there's a 50% chance you'll develop arthritis. And it's not just aging that causes arthritis. Common injuries can lead to decades of pain until our joints quite literally grind to a halt. Desperate for a solution, we've turned to engineering to design artificial components to replace our worn-out body parts. But in the midst of the modern buzz around the promises of a bionic body, shouldn't we stop and ask if there's a better, more natural way? Let's consider an alternative path. What if all the replacements our bodies need already exist in nature, or within our own stem cells? This is the field of biologic replacements, where we replace worn-out parts with new natural ones. For instance, in your worn-out knee, we create new cartilage using a paste graft of your own stem cells and replace the meniscus and ligaments with ones from a donor. We are now moving into superbiologic enhancements, where we add novel cells and growth factors to the biologic replacement tissues. And our options extend beyond human tissue. By treating animal tissue and seamlessly integrating the best elements of the animal kingdom into our human anatomy, we create superbiologic replacement solutions and merge the best of evolution from different species.
Okay, so you heard that in the back of your mind at Singularity, and you knew there had to be some way to apply that to your knee. So if we're going to build a superhuman, the title of this talk, we need to understand who you are first. We need to use tissues that really, and devices that make you better than you've ever been, and we need to help you enter the world of the hyper-enabled, or what I call the anabolic era of orthopedics. And so first, who am I? Which doc did you come sit in front of for your knee? Well, I'm an orthopedic surgeon in San Francisco. I focus on keeping people active. I rebuild joints biologically and sometimes bionically, and in ways that permit people to return to sports. My goal for you is for you to die healthy, which you've heard before in different ways. I want you to be skiing at age 100 and drop dead on the ski slope. So the things I do for you have got to keep you going during that period of time. So my own personal story is I blew out my knee playing soccer in college. I admired the orthopedic surgeon who took care of me, except he took out my meniscus cartilage, standard of care. And then I, of course, developed arthritis. I went off skiing. I blew out my ACL. The surgeon did a microfracture and rebuilt the ACL, which I only added to my arthritis. And then I end up with this knee that you see on your right with a partial knee replacement and screws for the ACL. I want to help you not go down that path. So when you get hurt today, you have a choice. You can either get relieved of your pain and possibly develop arthritis later on in life, taking out all those tissues, which is standard of care. Or you can get restored, or maybe you could even be made better than you've ever been. You choose. So the choice might depend on your age. If you're younger, you might be more biased towards shifting toward biologic tissues. And if you're older, you might say, hey, you know, just pop in an artificial part. It might last till the rest of my life. And today we do that robotically, so we're much more accurate than we've ever been. The question is, though, who are you? You're sitting in front of me. I've got to take care of you. I need to know who you are. So who do you think you are? That's really an important question. Well, first of all, you've all heard, you know, you don't know who you are. You aren't who you think you are. You've got 100 trillion cells in your body or whatever. They're constantly turning over. Their lifespans are quite short. Honey, it wasn't me is actually probably true. And so who are you? By cell count, you're 90% microbes. 6 pounds of you is microbial. By DNA activity, who are you? Well, 60% of the DNA in your nose and 40% in your gut or vice versa codes for things that we don't know what they are. And 90% of your DNA is still called junk material. So how do we know who you are? And also, if I do things to you, they affect how your DNA expresses itself. So who you are today may not be who you are tomorrow. So who are you really? Are you human? Are you animal? Are you virome? Are you microbiome? Are you alienome? Or something new every day? And so 60 tons of cosmic dust falls on the Earth every day. And we know from recent experiments that microbes survive re-entry. So the search for aliens is over. It's you. So if I'm going to treat you, I need to know what it is my therapies are going to do to you. So am I going to make you better or make you worse? If I give you a simple antibiotic before surgery so you don't get an infection, right? Well, I'm going to blow out your bowel flora, create resistance. If I give you radiation, I'm going to change your DNA and create a new life form. If I give you a simple steroid, you're going to affect every single system in your body. If I give you a simple anti-inflammatory for your injury, I weaken your collagen and degrade how your tissue heals. And if I want to build you back into a superhuman, I have to figure out what you are. I have to do things that help you. I have to augment what you have. And maybe I can make you better than you were before. So the platform that we're using today to build you into a superhuman involves stem cells and growth factors and to create a biologic knee replacement. We use xenografts, animal tissue, to produce better tissues. And if I have to put in metal and plastic, I use a robot because they're so much more accurate than I could ever be. As you know, stem cells are these pericytes living on vessels, and you've already heard so much about them. They're the key to us providing an anabolic for your tissue healing. So over the last few years, if you came into my clinic, if I had to put a tissue into your knee, I would take your own bone marrow, spin it down, get your cells, concentrate your growth factors, and add that to the tissues. Some people did that with fat. Now I use amniotic tissue and growth factors because that beautiful layer of amnion is why the mother doesn't reject the fetus, and it's loaded with stem cells. And so the amnion is this massively rich source of stem cells and growth factors. In my clinic today, it's completely replaced cortisone. For every one of the sports injuries, we use it to accelerate healing, and I use it to augment any tissue I'm going to put back into your body. So I load these tissues with these growth factors by putting them in syringes and aspirate them in and provide vacuum and pressure, and then put them into your knee. So if I'm going to rebuild your knee from your injury from Frisbee yoga, I need to treat each one of the 3 tissues you may have hurt: the articular cartilage, the meniscus, or the ligament. Let me show you how we're doing that and how we're going to be doing that better in the very near future. First of all, your meniscus is the key shock absorber. And that's what protects your joints. And so commonly when you have that history, doc, I twisted my knee, I heard a pop, you've torn the meniscus cartilage. And unfortunately, it happens 1.5 million times in the US each year. 90% of them are just taken out of the knee. Come back and see me when you have arthritis, is what the doc says. Only 10% of them are actually surgically repaired, and less than 0.2% are replaced if they're missing. And the problem is, if the surgeon goes and repairs it, he way decreases your chances of developing arthritis. So the data is overwhelming, and yet the financial incentives and time are not there to stimulate that surgeon to replace your meniscus often. Now the problem is, if you lose the meniscus, the articular cartilage, the bearing surface of your joint, that white shiny tissue when you crack open the chicken wing, that's what gets arthritis. That's wearing down of that cartilage down to the raw bone. And if you regrow the meniscus or replace it, you can prevent that arthritis. And so that shock absorber for the meniscus is what protects you. To regrow it, we can use a scaffold, or we can replace it today with human tissue donor, and in the near future with porcine tissue donor. So here's how we do it. First, a technique that we developed in the mid-1980s. We took cow Achilles tendons, ground them up, stripped them of their antigens with acid washes, formed them back into a collagen scaffold. And if you tear your meniscus today and you're in my clinic, I'm going to repair that damaged tissue, augmenting that repair sometimes with a collagen scaffold if you're missing tissue. And that scaffold sits into that defect that you might be missing and regrows that missing meniscus cartilage. And you can see we've optimized the pore size so cells will grow into it, and it regenerates very normal meniscus tissue. And today I augment that healing process with amniotic growth factors and stem cells in order to accelerate it. Now, if you've lost your meniscus, the surgeon took it all out, or you really smashed it apart, or you have arthritis and damaged it, I'll put back a whole new meniscus. And today we do that with human allograft donor, again augmented. And so here's a human allograft donor going back into someone's knee that was missing it. And so we can also 3D print these, as you've heard a lot about 3D printing. It's pretty cool. It looks great for companies when you're doing presentations. There's absolutely zero advantage for human tissue at this time. Now, the articular cartilage, remember that bearing surface that becomes arthritic. So in 1991, we developed a progenitor cell. We didn't know there were stem cells then, so we called them progenitor cells out of the bone marrow. Technique of making a paste graft. We take that damaged articular cartilage in your knee, create a fresh fracture out of it, pack this paste into it, applied motion, and regrew cartilage. Today, we would do the same things, just augmented. And we've recently looked at our patient follow-up, and we know that we can protect those knees out for 16 years. That patients, when we look back at them, 80% of them had improvement in pain and function out to 16 years. That's pretty good. If you're 40 or 50 and you don't want to have a knee replacement, and we can buy you 10 or 20 years, that's pretty good. But that's not building superhumans. And if we want to get to build superhumans, we've got to do even better than that. And so listen, the path forward is tough. Aging is not for sissies. You all know that. 70 may be the new 50, but your tissues are still 70. And so if I'm going to build a platform for you of making you into a superhuman, I've got to use tissues that are not your own. And so there are certain things in nature that are even better. If you look at articular cartilage from elephants, and I'm not proposing that we harvest elephants, but please understand, their cartilage is thicker, they grow to enormous weight, they have excess matrix production, they can run 15 miles an hour, they live to 60, they don't develop arthritis. There's something unique about that articular cartilage that we're going to figure out and use. Pigs are our friends. They sometimes even look like us. They're enormous amount of supply. They're eaten, so animal rights issues are usually minimal, abundant, inexpensive. So in 1996, we said, what is the barrier to me using pig bone, patellar tendon bone, for an ACL for my patients? It's young, healthy, stronger than human. The barrier clearly was immunology. And so we developed an enzymatic cleavage technique to wash away the key carbohydrate that causes rejection when you put animal tissue into people. Now, this is only tissues I can kill. So I couldn't do it for a heart or a kidney or a lung. But a meniscus or an ACL or a bone or a cartilage, I can wash that tissue, kill all the cells, wash away the epitopes, and use it as a younger, healthy platform for your knee. And so we do that exactly. We strip it, then we repopulate it with your cells, and we've demonstrated that even after that technique, the biomechanics are still better than yours. And we know that because as you age, you decline at 1% to 2% per year. And so I want to use young, healthy tissue, not your tissue, if I'm going to rebuild you, especially if I'm going to rebuild you to being better than you were before you got hurt. And so what we do is we prepare that pig tissue. It looks just like human tissue. The surgeon wouldn't know the difference, and put that back into the patient's knee. And the first group of patients we did are now out 15 years. And of course, this patient never listens to the doc, goes out and skis and wins the Canadian Masters Downhill Championship 3 times in a row on what he called his pig leg. And then we went ahead and did a prospective randomized double-blinded clinical trial in Europe and demonstrated that the xenograft tissue was at least equivalent to allograft tissue in the first 2 years.
I was a very competitive ski racer, both racing internationally as an amateur and about 10 years on the World Professional Ski Tour. donor tissue for the reconstruction came from my hamstring. My hamstring never really recovered from that. The Z-leg implant on my right leg, because there was no trauma to any part of my leg, the hamstring or the patella tendon, the operation was smooth as silk. I have no signs that I ever had knee surgery. I'm here now in my 11th year follow-up. I can exercise, I have full range of motion, never any swelling or aching. My left leg is about 60% of my right leg. I'm always plagued by little aches and pains. The hamstring tendon isn't as tight and as solid as the Z-leg in my right leg. I'm 52 years old. I'll probably ski 60, 80 days this year. Hopefully one of these days I can have a Z-leg put in my left leg.
And so the patient has a choice. Do you use donor scaffolds and tissues, or do you use artificial materials? And when do you pick? And so here's the challenge between the bionic and the biologic era. You've heard so much about bionics, artificial materials. I want to make the case for you that biologic tissues will win out every day. So the risk of offending anyone, and I don't mean to, here's my case for you after what I've presented. Bionic tissues are interesting. They're stronger. Maybe you have better hearing. Maybe you can even have better eyesight. And we use robotics today to put artificial materials into people's knees. We build a CD model of it. We model their own knee before I ever take them to surgery. I take their implants and match them on the computer screen so I know exactly where they're going to fit, so I can take away the least amount of bone and make the smallest incision possible. So robotics have changed my ability to use bionics, and they've made it so much better, but it's still artificial material. And so what happens in an OR with a robot is just as you're seeing on the screen, we'll go ahead and place the implants in through a pretty small incision, matched exactly to the patient's knee. However, biology has huge advantages. Which one do you want? Thank you.